who come on the network, who come from the Teledoc network to have conversations with us on different specialized issues, health issues. Basically, my name is Fumi Bangala, and today we're going to be discussing a topic that most people think is just normal part of aging or normal way of life. Losing your teeth. That's the topic. The causes of it, the significance of losing your teeth, the prevention of it, and the treatment of it. Many people think that once you get older, then tooth loss is inevitable. But is that really true? Let me see. How many teeth? Okay, I've not lost any teeth, but I've removed one because the way my wisdom tooth is shaped. But I say come out well like that. So they had to remove one, the one in front of it. But as people get older, like for instance, in my mom's family, they lose their teeth in a particular place. I don't know if it's generational or if it's just that they just have like they all sweet tooth, so they all remove their tooth in a particular place, and then over time they start removing their tooth. So the question is tooth loss the problem, or is it as a result of bad behavior, bad habits that we've been doing? So whether it is maybe gum disease, maybe diabetes, maybe smoking, maybe injury, maybe poor oral hygiene. Some people, I remember this week, a friend of mine posted and said, "You don't brush your teeth twice a week, or bunye." That's actually what she said. And some people don't brush their teeth twice a week. Some people do once. Some people don't even brush their teeth at all. Right? So we're going to be talking about different things that even beyond appearance. Some people, when they start losing their teeth, it affects their confidence. It affects their social interactions. It affects their speech. It affects different things. So today we're asking our doctor, who we're going to bring in shortly, why do adults lose teeth? Can tooth loss be prevented? What does losing a tooth tell us about a person's oral health, and what treatment options are available? So let's bring on our doctor for today, Dr. Adeniji Ilori, who will help us understand the causes, the significance, the prevention, and the treatment of tooth loss. But before then, we are live on YouTube at WFM 917. You can listen to us on the go by our website, www.wfm917. And the phone lines are open: 07000 917 917, 800, beg your pardon, 1235 917. You can send your text messages to 0703 1756 537 or 08155 917 917. Now that is out of the way, let's get into it. Good morning, Dr. Ilori. How are you this morning?
Good morning, listeners. Good morning, everyone. Okay. Also, I'm also happy to be on this call.
Glad to
My
have
name
you
is
here.
like the presenter said. My name is Dr. Ilori Adeniji. So I'm a senior registrar, restorative dentistry. So we restore teeth or tooth that has already been damaged or decayed. So if you don't want to remove it, we try to restore it
Right.
for you.
Okay. Thank you so much for coming on the program today. Okay, let's get into our first question. Is tooth loss, which is the first thing I said, is tooth loss a normal part of aging?
Yes, tooth loss is a normal part of aging because age is also a risk factor for tooth loss.
Okay.
So it's a normal part of aging because as we grow older, there are some things that happened on the tooth and also likewise from the gum. That's the periodontium. We have we call it gingival tissues. Periodontium includes those muscles that help to hold the tooth inside the socket. So there are some changes that occur. So tooth loss is part of aging. So
Okay, awesome. So what are the leading causes of tooth loss among adults?
okay, the causes of tooth loss are many. They are numerous, and part of it is we have the dental caries. So dental caries is a localized bacterial destruction of the dental hard tissues. Dental hard tissues are the tooth itself. So when there is a bacterial destruction or damage of it, That's when people usually say, I have a hole on my tooth, I have these, I have cavities. So we call it cavities, we call it caries, but most people will call it holes on the teeth. So it's caused by bacteria generally. So that's bacterial destruction of the teeth. And we also have second point there, we have the periodontitis. That's infection of the gums around the tooth. Because like I said earlier, there are some ligaments, we call them periodontal ligaments, that helps to hold the tooth socket. So when there is destruction of those ligaments by infection, by bacteria, they tend to get loose. And also we have the cementum around the tooth. And when there's infection of them, generally they get loose, and sooner or later you will just see most of the teeth in most of our adult women and men are already shaking. They are already mobile. So that's one other point there. I mentioned caries, I mentioned periodontitis, and likewise we also have trauma. Trauma in the sense that if there is a fall or maybe a road traffic accident or what is generally contact sports. In a contact sport injuries, maybe orthodontic extractions and some other things that can fracture, that can break down the tooth. So those things can also cause tooth loss. Whereas we also have oh, this other cause, we have endodontic failure, probably if the tooth was treated and later fractured, or congenital absence, probably the tooth did not even develop at all in that region. So there can be absence of a tooth like that. And also we have tumor or cyst, probably that cause obstacle to the eruption of the tooth, or probably does not even exist at all, because the tumor or the swelling can make a tooth to be absent from developing. So those are the factors that can cause tooth loss. We have dental caries, we have periodontal disease, we have trauma, endodontic failure, congenital abscess, and tumor or cyst. That's just part of the uh, causes of tooth loss.
Okay, thank you so much, doctor. So what's the difference between losing a tooth because of decay and losing a tooth because of gum disease?
Okay, losing a tooth because of the means that there is bacterial destruction of the tooth dental hard tissues. The hard tissues there is the tooth itself, because for a tooth we have the three layers: the enamel, dentin, the pulp. So when the destruction of that tooth is occurs and there is now a hole, actually there's supposed not to be a hole, a cavity on our tooth. But when you start noticing that there is a cavity on your tooth and it starts harboring some food decay, debris, and the rest, then you start having that accumulation of debris of food particles on that tooth. And sooner or later, the debris will become deeper. And what causes this hole are bacteria. And due to improper cleaning of food debris from our teeth, because when we eat food or sticky food like that, and if some parts are still on your teeth, and sooner or later those food debris, we call demineralization of your dental tissues. That's the enamel. And when there is demineralization of those tissues, then it will get softened. The bacteria will enter. They will start making their headway down to the pulp, and that's what will cause the pain. That's for the caries. But for the periodontitis, that's infection of the periodontium, which include the periodontal ligament, the cementum, the gingival tissue. So when there is infection of those periodontal tissues like that, they will um, tend to relax the the tension that hold the tooth down into the socket. Because when those periodontal ligaments are softened, they are relaxed, then the tooth become mobile. It becomes shaky. Some people say that my tooth is shaking, my this and that. So gradually the mobility will start mild, low, then it will gradually increase. So as soon as you notice that you're having mobility, your teeth is shaking, then you see your dentist on time, because several things could also cause that. It could be as a result of maybe plaque accumulation. That means probably you have a lot of dirt around your teeth, which you need to clean out. And probably you are using some cleaning devices that is not recommended, because when you use some cleaning devices, it also causes tooth mobility. And those are the things that can actually cause gum infection, periodontal disease to set in. So we have the caries, tooth loss due to caries and tooth loss due to periodontal disease. Those are the differences.
Okay. Thank you so much for that. But can tooth loss sometimes be a sign of maybe an underlying health condition that they are not aware of?
Well, tooth loss, like I said, can also be, yes, you are correct, because we have congenital missing teeth. Some people with some syndromes who have some missing teeth. We have the people with ectodermal dysplasia, they could have some missing teeth. People with hypodontia who have some missing teeth. So there are some underlying conditions, systemic underlying conditions that can cause missing teeth, which may not even develop at all. Because people with hypodontia, we have maybe out of 32 teeth, some may have just 10, some may have just 8. So likewise, for people with ectodermal dysplasia, those are the syndromes that can occur, that people can have missing teeth congenitally. So they may not even erupt them at all.
Okay, this is still Women Radio 91.7 FM, and we've been talking with Dr. Adeniji Ilori on, tooth loss, the causes of tooth loss, what tooth loss is, who's at risk of having tooth loss. Okay, a lot of people worry about the cosmetic parts of losing a teeth. Oh my gosh, my teeth, I won't be able to, like, my smile will be somehow, things like that. But why is tooth loss why is it a serious health issue?
Yes, tooth loss is a serious health issue, because one, pertaining to the individual himself or herself, and also to the society. Because when there is occurrence of tooth loss, that's when it can cause functional impairment. That's functional impairment to the individual. Like, there will be disruption of you eating properly. That's mastication. We call it mastication because there will be mechanical impairment in that aspect. You won't be able to masticate your food very well. Imagine when you are supposed to chew your rice very well, you are just swallowing your rice. So those are the things that can happen, because there is no teeth to grind it properly. Because normally we grind with the back teeth. We call it molars. So we grind with the molars, and if there's deficient or absence of those molars, probably you have lost them, then you won't be able to grind properly. Even the loss of the anterior teeth will also bring about aesthetic concern. When you have lost the anterior teeth and when you smile, there are some uh, windows on the anterior
Yeah,
part.
yeah,
Then there will be aesthetic concern, because it will also affect your psychological effects. It will bring some psychological effect there too, because psychologically you will be thinking about it always, and it will affect your confidence level. It will affect several things about yourself. So, which can also cause you not working properly at your working place. Probably at work now, maybe a client come and you want to talk and you want to market your product, you won't be able to open your mouth very well. And the client will now be wondering what is happening. So several things can also happen. And also, generally, to affect reduce quality of life because all these things will boil down to you not have the necessary, you not having to do the necessary things to achieve your aim, your goal in life. And also, apart from all those things, in the mouth, we can also have the movement of your teeth. When there are some teeth that are lost like that, there can be movement of those of the remaining teeth into the space of those ones that are already been lost, and this will cause some um, bone resorption. The jaw will become smaller gradually on that side because the tooth is part of what is making the jaw to have shape. Because when you have lost some significant part of it, maybe on one particular side, the jaw on that side becomes smaller and your cheek will start moving inside. So the teeth is also part of what is giving you that cosmetic value of having the shape of the jaw, shape of your face, and the rest. But if you start losing them, then several things will set in,
Yeah.
like yes, yes, and also we have occlusal instability, joint pain can also set joint pain, bone resorption, super eruption of the opposing tooth, either upper or lower. Because when you, for instance, let's say you have lost the lower molars now, the upper one can just super erupt and start biting on the gum of the lower. So you start having some trauma to that aspect. So those are the things that can happen that effect of losing someone's teeth can cause to an
Mm.
individual.
Hmm. So
So
we're still speaking about, thank you so much, doctor. Still speaking about the causes of tooth decay. Is there a point where you're like, this tooth cannot be saved anymore? Because at the beginning you talked about how sometimes the tooth can be recovered. Do you have the point where you're like, there's no hope, let's take it out?
yes, like I've said, I'm a restorative dentist, and when a patient comes to us, we try to review the patient. We clinically we review the patient. We also send for an X-ray radiograph to also see what has happened to the tooth, and before we can say, okay, this tooth we need to do this particular treatment, this and that, and the rest. So, but if we assess a tooth and the hard tooth around that particular tooth has already been damaged beyond what we can repair. Yes, we just send for extraction because there is no point you repairing a tooth and the patient will still come back with complaint.
Hmm.
And most tooth you can't just repair and because there's no how you repair it. Probably if the patient is even ready to pay money for the process, we need to tell the patient the hard truth about this thing,
Yeah.
the 50-50. Probably if you put down your money, we go ahead with this can happen because the prognosis may be poor. And we need to explain to the patient because there are some things we need to check around that tooth. There are some
Yeah.
things we need to check inside the radiograph, the x-ray
Mhm.
that we do. So there are some things we need to check. So before we can make our conclusion that we are doing a particular treatment. But if your tooth has a poor prognosis, then we need to send for extraction of that tooth.
So how significant is oral hygiene? Would you say that bad oral hygiene is also one of the causes of tooth loss?
Yes, bad oral hygiene is also one of the causes of tooth loss. Like I've said before, I said that some people we have plaque accumulated on their teeth and they won't be bothered to go and do
Mm.
scaling and polishing
Mm-hmm.
because scaling and polishing is what we use in removing those plaques, calculus that can damage our teeth.
Yeah.
The plaque is accumulation of bacteria. Like we have about 70% of bacteria embedded in the plaques. And if you
Uh-oh.
leave a plaque on your teeth, a plaque, a calculus on your teeth, then you are inviting the bacteria to come in and they will start working on your teeth, damaging, breaking it down until you have cavities on your teeth. And That will also enhance more bacteria to enter. And when they have done their damage, gone right inside the pulp, then you'll be having pain. Most likely, like you have said earlier, the tooth can be repaired. And if it has gone beyond repair, then we just have to send for extraction.
Hmm. Wow. Okay. Let's move to diseases. What role does diabetes play in tooth loss?
Hey, thank you for that. Diabetes plays a significant role in tooth loss. Like the people that have diabetes, most of the time, they have periodontal disease issues, and which will also affect the tooth because the diabetes will reduce the collagen formation, and we even destroy some of the collagen that are present on the periodontal ligament holding the each of the tooth down into the socket. And when this happens, there will be severe mobility gradually, but it will start mild. It will start on a low level, gradual mobility, which will also end up being in the maybe grade 2, grade 3 mobility. And when that occurs, then definitely for most of the teeth, some diabetic patients that are uncontrolled diabetes, we surely have that. But if it is a controlled diabetes that the patient is actually using drugs in a correct form and regularly, those will not occur, will not happen at all. They will have normal dentition, everywhere will be okay. The periodontium, the gum, the gingiva will be okay, will be fine. But if it is uncontrolled, then you see abscesses here and there on the gum, on everywhere. So the teeth will become mobile. So definitely diabetes can affect tooth loss. But if it is uncontrolled, but if it is controlled, the patient is fine.
Okay. All right. Many people think that, oh, it's just one tooth I'm losing. I'm losing. But what happens inside the mouth after that tooth is lost?
Yes, what happens inside the mouth after a tooth? Let's say, for example, maybe you lost a tooth now.
Mm-hmm.
What will happen is one, gradually, let's say for the first 2 weeks,
Mm-hmm.
there will be remodeling of the bone on that side because that hole, that socket inside the jaw, we need to close up. So there will be remodeling of the bone. Actually, the gingiva would have closed up, but all this bone remodeling and the rest will be inside the bone there. So it will remodel. Then gradually, over time, there will be resorption because there is no other thing holding up on that tooth, holding up around that area inside the jaw. There will be resorption. Resorption means that there will be loss of the bone level on that area, that region. The bone in that region will gradually reduce in height, reduce in volume, reduce in width. So there will be reduction in all area of that particular region. So and also there will be uh, drifting of the either the posterior teeth or the anterior teeth. I mean the teeth, those teeth behind and in front of that missing place. There will be drifting. They can either move forward, move backward into that space, and which will also destabilize, cause malocclusion. It can also cause debris accumulation and the rest.
Okay, thank you so much. So, what warning signs would you say the person will start feeling before the when it comes to tooth loss? Like, is it pain? You mentioned pain earlier, but in the case of tooth loss, what are the warning signs that they should be experiencing before they get to that point?
Okay, yeah, the warning signs are one. I would say that immediately you have hole on your tooth. We call it cavities. Immediately you notice that you have cavities, you have caries, and they started forming on your tooth or teeth probably is one or two that you're having the cavities on, then you report to your dentist on time to fill it. Prevention is better than for you now to start looking for how do we save this tooth? How do we do this? So prevent it on time. So visit your dentist on time. Let them do the dental fillings on time, dental restorations. We have different types of dental fillings material that we use. So let them do it on time so that you can actually block that hole. And also, some of the warning signs, let's say, for instance, for the periodontitis, one, you'll be having inflammation of the gums. When you start having chronic inflammation of the gums or the gingiva around that area, and it's not resolving, and you start noticing pockets when you eat, and you start noticing that some food are entering your gum, not on the tooth now. Some people say, I have hole in my gum. You can, yes, you can have hole in your gum, but that means that actually traumatize that area, whereby there is now a bone loss on that aspect, and food is now entering and settling under the gum, and which can also be causing a sort of infection in that area. A sort of infection affecting the tooth, the stability of the tooth. And when you start noticing that your tooth is now getting mobile, maybe gradually, it will start gradually, not mobility that will be shaking. No, gradually, when you start noticing, my tooth is mobile, then you visit your dentist on time. And when you start noticing that you have a plenty calculus, plaque on your teeth, then you visit your dentist for treatment. So those are the ways that you can visit your dentist on time before you move to the maybe grade 3 mobility of tooth loss and the rest.
That's interesting. I've never heard of tooth under the gum, in between the teeth, yes, but or lodged in between the teeth, yes, but under the gum, I haven't seen that before. Still speaking about the gums and the teeth, some people when they brush their teeth, they bleed when they are brushing, right? I don't know, maybe depending on how hard, or maybe the toothbrush, the fiber of the toothbrush they're using. But when should they be concerned? Should blood even be coming out when you brush your teeth in the first instance? Let's even start from there.
No, blood should not be coming out when you brush your teeth. And when blood comes out like that, that means that there is presence of inflammation ongoing. Infection is ongoing, and which you should not condone at all. You should visit your dentist on time for that. And those things that can cause inflammation when you brush your teeth are primarily the plaque and calculus on the teeth that you need to remove on time. So blood should not be coming out at all. And it now depends on if there is presence of inflammation, you tackle that one, and the kind of toothbrush that you use. What type of toothbrush are you using? Is it a smoker toothbrush? Is it a hard toothbrush? So those are the things that you need to look into also, because if you are using a hard toothbrush or a smoker toothbrush, then definitely when you brush, your teeth will be bleeding. But we recommend that you should use a soft bristle or medium bristle toothbrush, because you can't be using a hard toothbrush and you'll be brushing and blood will not come out. But use a soft bristle or medium bristle toothbrush that can go in between your teeth, clean it very well, and your gum will be okay. You are cleaning the teeth, not the gum. So the blood should not be coming out when you brush your teeth.
Okay, thank you so much for that. So how often should adults get routine dental examination, get their tooth cleaned? How often?
We recommend that adults should come for generally everyone, not even adults, generally everyone, young children, everyone. So twice in a year is recommended that you should come for scaling and polishing. So you call it teeth cleaning, but we call it scaling and polishing. So you should visit your dentist for scaling and polishing and general checkup. General checkup for all the teeth, because you may not know if a tooth is having cavity, maybe here and there and the rest. So when you go for general checkup, then they will also recommend you do your scaling and polishing so that your teeth can be healthy and your gums can also be healthy. So the general checkup and the scaling and polishing is for everyone. Either you're even from 1 year old, 2, 3, up to adult, maybe 85, everybody, twice in a year, every 6 months, you should go for your general checkup and scaling and polishing.
Okay. All right. Moving on, moving on, moving on. This is still Women Radio 91.7, the voice of women, Nigeria's first and only radio station for women and their families. And we've been speaking with Dr. Ademiji Ilori on Radio Doctor this morning on tooth loss, the causes, the significance, the prevention of it, and the treatment of it. We're just going to slide right into treatment. Is it always necessary to replace a lost teeth? I be a missing tooth, yeah.
Yes, it's very necessary to replace a missing tooth or probably having missing teeth. So, because if you don't replace it, one, like I've said, it will cause drifting or movement of the front and the back teeth. It will move, cause malocclusion. You won't be able to eat properly on that side. It will be there will be danger to your gums on that side. You'll be traumatizing the gum on that side. One, and also um, there will be infection, more infection to the gum on that side. So, and resorption of the bone is also part of it. Your jaw becomes smaller on that side. And if that occurs, then the aesthetics will also be affected. Like I said, when you lost a tooth, or maybe let's say, for instance, you lost one part of the side of the face like that, your
Yeah.
cheek on that side will move inside. It will move inside and it will affect your aesthetics. You won't be able to eat properly, you won't be able to speak properly, and several things can occur. So um, many things can occur with you losing your teeth. So thank you.
Oh, so losing your tooth can actually affect you eating and your diet.
Yes, it can
How?
affect because when you lost a tooth or a teeth or some teeth, rather, you won't be able to masticate properly.
What
You won't
does
be able to
masticate
eat
mean?
your food. Masticate means that you won't be able to chew your food
Okay, right.
very well on that side. You won't be able to chew the food very well because you just be swallowing some, maybe you chew halfway, you swallow it, and this and that. So let's say for instance, because we use the molar, we use the back teeth, the molars for grinding our food. And if you don't have the molars, then you only have the front teeth, the anteriors. You can't be using the anterior to grind your food. It won't you it won't it's not proper. That's not the
I
work
get you.
for them. So you are overworking them and you are using
Mm,
them for a wrong thing. So you won't be able to chew your food properly. So it
right.
can cause several things. So the nutrition that you are supposed to get from those food, you won't be able to get it.
Mm. Okay, now let's move to like for some people who remove their teeth, they have options like dentures, bridges, dental implants, and things like that. Can you explain the differences between them and when a person or which one a person should use at which point in time?
Yes, the options for tooth replacement. We have the dentures, like you have said, we call it removable partial denture, and it could either be complete denture, probably the whole mouth, the whole teeth has been removed. There is no teeth again in the mouth. So those people they use complete dentures. So if you still have some teeth in your mouth, probably one or two or three or four of them has been removed, then you have removable partial denture, whereby you can put and remove at will on your own.
Okay.
So likewise, the complete dentures also. So apart from that, we also have what we call the dental bridge. So we call it fixed partial denture. It's a fixed partial denture. So whereby, let's say for instance, you are missing one tooth, and the tooth in front, the tooth at the back can be prep a little round it like that. Then you now put a 3 unit bridge, a 3-unit bridge to on that the front abutment and the posterior abutment so that they can hold the pontic. We call it pontic. Sorry that I'm using
In
some of
fact,
my so, but we call it so we need to prepare the front teeth that is in front of that missing part, the back teeth, so that we can put a bridge. A bridge is like we are joining 3 crowns together. So we join 3 crowns together so that to cover that missing aspect, that missing tooth. That's what we call a bridge. So if it is you are missing 2 teeth, we join 4 crowns together so that to cover that 2 missing teeth in the middle. So that's a bridge. So that's for bridge because we have to touch the tooth in the front, the tooth at the back to do that bridge. That's one. So for the dental implants don't need to touch any tooth in front or at the back. If you are missing a tooth, you just come for review with the dental implantologist. You have to review, okay, since when have you lost your tooth? He or she will ask you some questions. And we also assess the tooth, the bone volume, the quality, the quantity, and the volume of that bone remaining inside your jaw, if that is enough to carry that implant. Because we need to assess it properly so that you won't have implant failure. Or so because when the implant fails now, you won't say that, but we need to assess properly so that we tell you the real fact. If probably if the bone is not enough, then we do bone augmentation. We have to add some artificial bone around the your natural bone, the socket, so that we can get enough volume of bone to put that implant inside. So after getting that, then we can go ahead with the implant. But if your natural bone is enough, then we can just put the implant and that's it. So we don't need to touch the tooth in front, the tooth at the back. So those are the differences. And also the amount we pay for each of these treatments, like the implant, the dental bridge, the denture are also different. The least among them, the least costly among them is the dentures. Dentures are also costly. They are also the prices are even lower in government hospitals, but in private they are a bit high. Let's say times 3.
wow.
So the dental bridge,
That's not a bit high,
oh,
that's high if it's times 3.
the dental bridge, because like I've said, we count it by units. Let's say you want to do a dental bridge for a tooth that is missing. That means you are doing 3 units dental bridge. So if you are doing 3 unit dental bridge, that means you are joining 3 crowns together. So let's say, for instance, in where I work, our crown is 56,000. 56 times three, that would be for 3 unit bridge. But if it is some other clinics outside there, it could be up to like 200 thereabout. So let's say 200 times 3. So that's what you pay for dental bridge. If it is an implant is a bit higher. So for in some government hospitals, implants could go for, let's say, 500,000, both for the treatment fee, the implant kit, and the rest. So everything 500,000. But that amount. But in some private, it could be higher than that. So it depends on the number of implants you want to do, if it is 1, if it is 2, and the rest. So that's it.
Wow, thank you so much, Doctor. Oh, we have run out of time. Thank you so much, Dr. Adeniji, for today's discussion. But finally, before we go, what message would you like the listeners to remember about protecting their teeth and the health of their teeth for their life, basically?
So in conclusion, I will want to say that prevention and early intervention is very key to you losing your tooth or teeth. Because when you have lost a tooth, to replace is not an easy thing at all. Because even though let's say for instance, you are going for a denture, putting it and removing it is work on its own. because and you need to follow the instructions on how to keep it. Probably if you're at home, you need to put it in a cup of water, close it very well. You need to get a toothbrush separate for it, clean it with soap, this and that. So it's good that you should keep your teeth intact. Clean, brush regularly, brush morning and night. Use a fluoride toothpaste to brush morning and night. That's the ideal. Use a fluoride toothpaste, brush morning and night. Visit your dentist regularly. Every 6 months, do your dental checkup, do your scaling and polishing. Let your dentist check your teeth. If you have any complaint, do it on time. Don't say that you'll come back for it. If you say that you come back for it, you will forget, and the worst may happen. So do your dental treatment on time. If you have O, fill it. If you have RCT to do it. If you have crown to do it. Dental implant and the rest, do it on time. Don't waste time, because time wastage will cause a lot for you, and the treatment cost will even be higher, and the consequences too. Yeah. Thank you.
Thank you so much, Dr. Adeniji, for coming today. Give the enlightening discussion on tooth loss, causes, significance, prevention, and treatment. If you would like to speak with Dr. Adeniji, please download the TeleDoc app today, book a 10-minute or a 30-minute consultation, and then you get your prescription and everything. Everything you need basically is over there. Thank you once again, Dr. Adeniji, for coming on the program.
Thank you very much.
All right. This is still Women Radio 91.7 FM. And we just finished with the doctor with our doctor speaking on tooth loss. As we go, please make sure you take care of your teeth. It's important so that you don't lose them on your journey in life and it doesn't affect you. Okay, with that being said, we've come to the end of Radio Doctor this morning. My name is Fumi Bangwala. Do have a